Hi folks, I'm Dr. Ed Beyer of Beyer Natural Health Solutions. I'm making this video to share with you a common complaint that I hear all the time, 33 years of practice in functional medicine, and they're like, doctor, why is my brain not working? People are complaining of brain fog, depression, anxiety, memory loss, all these different things. And the thing that I want to really teach you on this video is that all metabolic problems affect the brain. And the reason why is because people that come to me have metabolic issues. Now what do I mean by metabolic or metabolism? Simply put, metabolism means converting whatever you eat into energy. And 30% of our energy goes to our brain. The brain actually weighs 2% of our body weight. It consumes 30% of our energy. So any metabolic issue is going to affect brain function. It's very important that you understand that. Also, metabolic issues always create inflammation, and the brain hates inflammation. So some of the common metabolic problems that I see in my practice all the time that affect the brain is poor blood sugar, whether it's too high or too low, anemias, because anemia means you have an oxygen deficit and the brain needs lots of oxygen. Any source of inflammation will create a metabolic problem, such as food sensitivities, eating inflammatory foods, gut infections, dysbiosis in the gut, unstable blood sugar. Eating sugar and alcohol will definitely create metabolic problems. Eating bad oils like trans fats or vegetable oils, which are so prevalent in the standard American diet. Food sensitivities. The food that we eat today, folks, is so different than the food we ate 20, 30, 40 years ago, and our immune systems don't recognize it, and when we eat it, they react to it. Any digestive problem, because 80% of our immune system resides in the digestive tract. Things like leaky gut, dysbiosis, all these things create systemic inflammation and metabolic problems and malabsorption too. Autoimmune disease is prevalent, so prevalent today because our immune systems are working harder than ever because there's more things in our environment that didn't exist 30, 40 years ago. So autoimmunity is skyrocketing. Thyroid issues are so prevalent today. There's 22 reasons why the thyroid can go bad, and so many people have it, and traditional medicine is woefully inept when it comes to managing thyroid issues. Hormone imbalances, especially the ratio between progesterone and estrogen in females and the ratio between testosterone and estrogen in males. Adrenal dysfunction, which are our stress glands, and even genetic mutations will cause different metabolic problems that will affect brain function. The nervous system, as I mentioned, is the area of the body that requires the most energy. That's the brain, the spinal cord, and our nerves. So if you have a metabolic problem, your brain will not work right, and because your brain is the most metabolically active organ in the body. So now there's 5 different categories of neurological problems. Now folks, these are functional neurological problems. These are things you cannot see on an MRI. Those are structural neurological problems. These are functional neurological problems. The first category is abnormal sensations. Now what would that be? A common one is ringing in the ears. I see that all the time. Numbness, tingling, excessive pain like we see in fibromyalgia, not being able to hear things right. Sensitivity to cold or being cold or hot all the time. The second category is abnormal movement, muscle twitching, muscle cramping, constant, you're losing your balance, motility problems in the gut. Abnormal cognition or thinking. So we see inability to remember things, lack of motivation, things that used to give you pleasure don't give you pleasure anymore. Depression, anxiety, those are cognitive, more frontal lobe areas of the brain that start to decline because they don't have enough energy because of these underlying metabolic problems. Even abnormal posture. My background's in chiropractic, and a lot of people come to me with neck problems, spinal problems, and the problem's not necessarily in the spine, it's in the area of the brain, the cerebellum, that controls our postural balances and our spinal reflexes. And abnormal autonomics. Now the autonomic nervous system is the part of the brain that controls bodily functions automatically. It primarily resides in the brainstem, and there's 2 divisions in this area of the brain, the autonomic nervous system. We have the parasympathetic, which is rest and digest. Most of the time, that part of the autonomic nervous system is active, and the brain is constantly making that active. Then we have the sympathetic, which is the fight or flight area of the brain. Now, normally that's being inhibited because normally we're not in a fight or flight situation. So what happens is the brain is mostly exciting the parasympathetic portion of the autonomic nervous system, and it's inhibiting the sympathetics. Both of those require energy. To activate parasympathetic requires energy, and to keep a brake pedal on the sympathetic requires energy too. Most of the time, the brain is stopping things from happening. It's inhibiting things. So weakness in one area of the brain can cause a lack of inhibition, and we'll see an increased firing in areas of the brain that we really don't want. Now, the main area that we really want to inhibit most of the time is that fight or flight sympathetic nervous system. And then the other area is our emotional part of our brain, which is called the limbic system. So most of the time, the brain is inhibiting these areas. Otherwise, we're in a fight or flight situation all the time, or we're having emotional outbursts that we really don't want, that are inappropriate. That requires energy to constantly suppress the sympathetic nervous system. When we have these metabolic problems that I just mentioned, we lack that energy, and so the sympathetic part of the seesaw starts to fire too high, and we start to see what's called sympathetic dominance. And so many patients come to me with these symptoms of sympathetic dominance or sympathetic escape because of the lack of energy to inhibit this area of the brain. This is the classic case of fibromyalgia, chronic pain. You know, most of us, we have different pain stimuli, but a brain, if it's really working well, can inhibit that. This is what we see in fibromyalgia: a lack of inhibition, headaches, sensitivity to light and sound, hormone imbalances because those aren't being inhibited, high blood pressure, inability to keep the blood pressure under control, poor digestion, frequent urination and UTIs, poor sleep, cold hands and cold feet are classic symptoms of a brain that's not having enough energy and an inability to inhibit the sympathetic or fight or flight portion of our autonomic nervous system. And then symptoms of limbic escape or emotional escape are, well, these are so common. They're ubiquitous that I see in my clinic. Irritability, lack of focus, anxiety, OCD, depression, mood swings. So what we do from a functional perspective is we identify these underlying metabolic issues that I mentioned earlier, and through natural methods, we correct them. When we do that, the brain starts to function much better. So if you like this video and you want to receive more videos, please remember to like and subscribe to my YouTube channel, or share this with someone that you know is suffering with these different problems. I'm Dr. Beyer. I hope you enjoyed this, and we'll see you next time.